Welcome, this is Snan and today we're going to talk about the urinary system. We're going to talk about the development of kidney and ureter. We're going to talk about the changes in position of kidney and its blood supply. We're going to talk about the development of urinary bladder, the positioning of ureter, and lastly we're going to talk about the development of urethra. So let's start. Urinary system. The urinary system consists of kidney, ureter, urinary bladder, and the urethra. Now the urinary system develops from the intermediate mesoderm. Now the intermediate mesoderm close to the dorsal aorta condense to form urogenital ridges. Now this urogenital ridges consist of two parts. The part which give rise to the urinary system is known as the nephrogenic cord, while the part which give rise to the genital system is known as the gonadal ridge. For now we are concerned with nephrogenic cord, which has three stages during the development of urinary system. Now first stage is the pronephros. The pronephros starts forming in the early 4th week. Here is the ectoderm, the endoderm, and the middle one is the mesoderm. The mesoderm close to the notochord is the paraxial mesoderm and lateral to it the intermediate mesoderm. The urinary system is formed from this intermediate mesoderm. Now during the folding, the embryo cut section looks like this, and the intermediate mesoderm close to the dorsal aorta here in the yellow, close to the dorsal aorta, condense to form the urogenital ridge. And the part of urogenital ridge which is concerned with urinary system development is known as the nephrogenic cord. Now pronephros part of the nephrogenic cord start developing in the early 4th week and is a transitory state. It develops in the neck region of the embryo, and it consists of two parts, that is nephrotomes and the pronephritic duct. Nephrotomes are the cells broken off from the pronephric duct, while the pronephric duct is a duct which runs caudally and opens into cloaca, which is a chamber common to the hindgut and the alimentary canal. Here is the nephrogenic cord, and this part of the nephrogenic cord, which is at the region of the neck of the embryo, is known as the pronephron. Now this pronephros consists of pronephric duct, which moves from the cephalic end of the embryo down to the caudal end and opens into the cloaca, which is a common opening to alimentary and the digestive system. Now this pronephros duct, this cell, some cells sloughed off, which are known as the nephrotome. So at the end of the 4th week, the pronephros stage regresses and the mesonephros state start forming. Now it is formed caudal to the pronephros, and it acts as a temporary kidney for 4 weeks until the permanent kidney is formed. Now the mesonephros consists of the mesonephric duct and tubules. The mesonephric duct, we can say that it is originally the pronephric duct, that is the distal portion of the pronephric duct, so we can say that it opens into the cloaca, while from the mesonephric duct arises the mesonephric tubules, which open into glomeruli. Here is the pronephros. Now the part distal caudal to the pronephros is the mesonephros. Here is the magnified version of the mesonephros. The mesonephros consists of mesonephric ducts here, and from the mesonephric duct arise the mesonephric tubules, and at the distal end of the mesonephric tubules are glomerulus. So since dorsal aorta is present close to it, so the arteries from the dorsal aorta move the glomerulus inside this glomerular capsule. So they act as a temporary kidney for up to 4 weeks. So now the third stage, that is the metanephros, starts forming in the 5th week. Since the mesonephros remains functional for 4 weeks after the late 4th week, and metanephros starts developing in the 5th week, so we can say that the mesonephros and the metanephros both state coexist at the same time until the 10th week, at which the metanephros completes its formation. So the metanephros is the primordia of the permanent adult kidneys. So they develop from two sources. That is, one source is the ureteric bud and the second source is the metanephrogenic blastema. Now, what is ureteric bud? The ureteric bud is an outgrowth from the mesonephric duct, which we have discussed earlier. The part of the mesonephric duct before it enters the cloaca. There an outgrowth is formed there, which is the ureteric bud. Here is the mesonephric duct, and at the point of the entry of it into cloaca, a diverticulum arises here, which is known as the ureteric bud. Now this ureteric bud is formed due to induction from the metanephrogenic blastema. Now what is this blastema? It is condensed mesoderm near the ureteric bud. So due to the induction, the bud elongates towards the metanephrogenic blast, and reciprocally during elongation it gives inductive signals to the metanephrogenic blastema, which is the future nephron. Since both of these structures are inducing each other, we call this phenomena as reciprocal induction. Again, this is the mesonephrotic duct, and a diverticulum arises at the point of entry into cloaca, which is known as the ureteric bud. Now the mesoderm close to the ureteric bud, by the induction from it, differentiate or condense into a blastema known as metanephrogenic blastema. Now look here. This ureteric bud elongates to form a long structure, that is stalk of ureteric bud, which grows into this blastema. Okay, so this blastema after reciprocal induction grows further, and the ureteric stalk differentiates into structures, that is first into renal pelvis. Then from the renal pelvis arise the major calyces, and then the major calyces arise the minor calyces, and then from the minor calyces arise the collecting ducts, which are first straight and then arch. Again, the ureteric bud elongates to the metanephrogenic duct. Now the stalk of the ureteric bud forms the ureter, while its part inside the blastema after induction first forms the renal pelvis, which then give rise to further branching to major calyx, then further branches give rise to minor calyx, and then from the minor calyx arise the collecting tubule, which are first straight, and then from the straight one arises the arch collecting tubules. Now these arch collective tubules, they induces the surrounding mesoderm to form vesicles known as the metanephric vesicles. Here is the straight collecting tubule, and from which arises the arch collecting tubule. Now the arch collecting tubule induces its surrounding mesoderm to form vesicles known as the metanephric vesicles. Now these closely related mesonephric vesicle elongate to form S-shaped metanephric tubules. Now these S-shaped metanephric tubules, at their proximal end they are connected with the arch collecting tubules, while at their distal end they form the glomerular capsule, in which the branches from the renal artery come and goes to form the glomerulus. And after further elongation, it gives rise to the distal convoluted tubule, the loop of Henle, the proximal convoluted tubule, and then attaches to the glomerular capsule. So it forms an adult nephron which is functional. Again, from the arched collecting tubule, induction causes the surrounding mesoderm to form the metanephric vesicle, which elongate to form metanephric tubules, which are S-shaped structures. Now these tubules at their distal end are connected with the structure known as Bowman capsule or glomerular capsule. Now these glomerular capsule get incorporated with the glomerulus, which are the branches from which is formed by the branches from the renal artery, and the adult functional nephron is formed. So after the formation of nephron, the kidney development is completed, but during its development there are changes in the position and the blood supply of the kidney. Let us say initially both kidneys are close to each other and are present ventral to the sacrum, that is they are present in the pelvic region, and the renal arteries to the kidney, that is arteries to the kidney, are supplied from the common iliac artery branches. While later on, as the caudal portion of the embryo grows, the kidney ascend, that is they go upward during the caudal body growth. So as the aorta supplies the kidney with the artery closest to it, with the branch closest to it, so their branches are shifted to the upward portion, so they are supplied directly by the renal arteries from the abdominal aorta. Here are the kidneys which are close to each other and ventral to the sacrum in the pelvic region. Now as the caudal portion of the embryo's body grows, these kidney ascend upward, and their branches, which initially come from the internal iliac, that is common iliac artery, so these branches regress and the kidney goes upward until they reach the suprarenal gland, and their arterial supply changes from the internal iliac artery, which was initial, to the renal artery directly from the abdominal aorta, which is at an upper portion. Now what about the development of urinary bladder? The urinary bladder, as we know that the urorectal septum, if we recall from the development of alimentary system, the urorectal septum divides the cloaca, which was a common chamber to alimentary system, that is the digestive system and the urinary system, into a posterior rectum and the anterior urogenital sinus. Here is the cloaca. So the urorectal septum here divides this cloaca into a ventral urogenital sinus, which is the part of urinary system, and a dorsal rectum and anal canal. Now we are concerned with this ventral urogenital sinus. So the ventral urogenital sinus consists of three parts for descriptive purpose, that is the vesicle part, the pelvic part, and the phallic part. The vesicle part is the proximal most part which forms most of the urinary bladder and is continuous with allantois, which is the posterior diverticulum of umbilical vesicle. So this allantois, which comes from the umbilical, later converts into ureters, which give rise to the median umbilical ligament in adults. Here is the urogenital sinus. It consists of the upper vesical part, the middle pelvic part, and the lower phallic part. Now this upper vesical part is continuous with the allantois. This allantois after time regresses into a ligament known as urachus. The urachus further differentiates into median umbilical ligament, which is an adult form, which starts from the umbilicus to the top of the urinary bladder. So the vesical part gives rise to most of the urinary bladder. What about pelvic part? The pelvic part in females give rise to entire urethra, while the pelvic part in males give rise to two of the three parts of urethra, that is the prostatic part and the membranous part. The third part, that is the spongy urethra, the part of it is formed by the phallic part of the urogenital sinus in males, while the phallic part also give rise to the primordium of penis in males and clitoris in females. Now we have formed the urinary bladder, but the ureter opens into the mesonephric duct instead of the bladder. How are we gonna fix that? So as we know that during development, as the bladder enlarges, the distal part of the mesonephric duct is incorporated into the dorsal wall of the bladder. Here is the mesonephric duct, the ureteric mud is arising from it, and then it gives rise to the adult kidney, and it opens initially, the adult kidney, the ureter opens initially into the mesonephric ducts. So as the urinary bladder, which is here shown in the yellow, grows, this mesonephric duct is incorporated into its dorsal wall. This one is the posterior view. So as the urinary bladder grows, the mesonephric duct is incorporated into its dorsal wall, so that the ureter of the kidney opens directly into the dorsal portion of the urinary bladder. As the kidney grows further, it opens into the basolateral surface at the apex of the urinary bladder, while this portion of the mesonephric duct, which gets incorporated into the dorsal wall of the urinary bladder, give rise to the connective tissue of bladder trigone. Also, both of these ducts join together and opens into urethra as the ejaculatory duct in males. So they form the connective tissue in the bladder trigone and also form the ejaculatory duct in males. So the duct dissolved and the ureter opens directly into the bladder. Now lastly, talking about the urethra. The urethra in female is formed entirely from the pelvic part of the urogenital sinus. We have discussed here, entirely from the pelvic part of the urogenital sinus. But in the males, as we know that urethra has three parts: the prostatic part, the membranous part, and the spongy part. We have discussed earlier that the prostatic and the membranous part are formed from the pelvic part of the urogenital sinus, which in female is forming the entire urethra. So these two parts are formed from the pelvic part of the urogenital sinus. While talking about the spongy part, the proximal 2/3 of the spongy part is formed from the phallic part. This part, that is the third part of the urogenital sinus, phallic part of the urogenital sinus, while the distal 1/3 is formed from the inward growth of the ectodermal cell from the gland penis tip. So here is the spongy urethra, which is formed from the phallic part of the urogenital sinus. Now the inward growth of the ectodermal cell, the blue line shows the ectodermal cell. give rise to inward growth from the gland penis, give rise to the ectodermal cord. Now this ectodermal cord, upon subsequent invagination of the ectodermal cells, give rise to the distal 1/3 part of the spongy urethra, which combines with the spongy urethra from the phallic part of the urogenital sinus to complete the formation of urethra. So that was all for today. Please subscribe the channel and thank you.